The next speaker for the day is Dr. Animesh Jain, who will be discussing about communication skills. Having successfully completed his tenure as head of department, Dr. Animesh Jain is currently a professor in KMC Mangalore. He is a professor in the Department of Community Medicine at KMC, and he is a former fellow from PSG FRI Coimbatore, and he has completed his PG diploma in bioethics and medical ethics from Yenepoya University, and is the head of Mangalore unit of the UNESCO chair in bioethics. Dr. Animesh Jain is the Deputy Convener of Medical Education Unit at KMC Mangalore and is also a faculty of two famous regional institutes, that is PSG FRI Coimbatore and M. Philip Manipal. He is also a member of Southeast Asia Regional Association of Medical Education. He has been awarded the Best Innovative Practice in Teaching and Training of Community Medicine. His areas of special interest are soft skills training, health professions education, research methodology, and bioethics, besides his core specialty and epidemiology. Sir, it's an honor to have you with us. Over to you, sir.
Thank you so much. First of all, a very good morning and a warm welcome to all the PGs. Of course, they've been attending sessions, and I have also been listening to the previous two sessions, and it's been nice to hear these two speakers. And some of those things actually had a good connection with what I'm going to talk also in some ways. So, this is a session on communication skills, and we are doing it online, obviously, because of the current situation in the pandemic. So, let me go straight to the topic. And as you say, this is important, of course. So basics I will cover, and this will be only for the basics for the PGs to apply in their practice. So before I go into, let me show that there was a needs assessment that I had done, and many of you, I'm thankful that actually you all have participated in that. I will show you the needs assessment. I hope it's visible. So I had asked you a few questions, 5 questions or 6 questions, and one of them was challenges that you have experienced with regards to communication in dental clinics or education. Now, many of you had this challenge of language and the language barrier, which I perfectly understand. Then some of you mentioned about a pediatric patient being anxious, or how to convince a patient, especially a difficult patient, compliance issues. You also talked about fear of asking doubts with staff, which of course is to some extent related with communication, but could also have some other associated factors as well. And there was somebody who wrote about network problem, which I am assuming that it is something to do with either the Wi-Fi network or maybe the mobile network. I'm not too sure, and I don't really know how exactly to address that. There was another thing on major issues or topics or session that you need in this particular session, which I am going to address. And you talked about how to deal with non-cooperative patients, doctor-patient interaction, confidence in communication. There was something about classes of regional language. There was a demand and there was a need felt, which again may be a little beyond the scope of this. Affordability of treatment. And then there were other things which came in, which I have kept separately because I thought this may not be totally in the purview of this session. Selection of thesis topic, time management, poor oral health awareness, and very mysteriously and strangely, which I'm still trying to decipher, somebody had written an H. So I'm still wondering what that is. All right. So these were some of the things. Now, many of you have actually had experience, and you thought that till now you have communicated well in many of the situations which were listed, but some of you also disagreed when it came to a colleague who had probably not done your duty, or there was a referral to be given, or maybe there was a difficult patient, or some things like that. And then quite a few agree that you have a good written communication, though 10.7% disagreed with that, and almost a quarter of you were not sure. Similarly, many of you believe that your communication skills, particularly in the non-verbal domain, requires an improvement. and 7 of you don't think that you need an improvement. You are already good. So that's good news. You would like to learn more of these things, and majority of you again say that you want to learn more of verbal communication, written communication, non-verbal communication, and active listening. And based on this, I have tried to tailor my session so that it is more effective and more importantly something which you want and which you desire. And I will try to give you that in the next 1 hour. So the learning objectives for my session, which of course now you understand that it's very important to have learning objectives from the first session. So at the end of this session, the participants shall be able to recognize the importance of communication, identify the principles of good communication, discover the power of well written communication, appraise the role of nonverbal communication, and justify the role of communication in dental practice and education. So these are my objectives, and let's see how we go about. So why is this communication important? Can anyone tell me? Can anyone tell me why is this communication important?
Teachers
Yes,
can come up with answers.
yes, please. Let this be a a two-way thing, not just me talking. And communication has to be equal opportunity for everybody, and both of us should have some kind of shared meaning. Yes, you can talk. You can put it in the chat box, and it can be told to me.
Postgraduates,
Are they around? Let me get some feedback that you're around. Why is communication important?
otherwise we'll randomly call them some names.
Yes, I heard some names in the previous sessions. There were some names which I heard, so I am familiar with Shweta and Atira, and so. But we can have some other people as well.
In the chat box, they are giving the
Right.
feedbacks.
Okay. Could you please tell me?
To understand the main concerns of a patient is one of the
Okay. Good.
for better patient orient relationship,
Great.
better
Excellent.
understanding of the problem between patient and doctor. The same thing.
Problem between or problem? The problem between
Problem between
patient
the
and doctor.
patient and the doctor.
Okay. And I'm just hoping that it's not a very regular thing. Because if there is a problem between patient and
Maybe
doctor and a regular thing, then there is something else we have to look at.
maybe the problem what the patient wants, want to
Okay.
communicate.
Right. Okay. Interesting.
Patient's confidence level, to gain the patient's confidence level,
Okay.
to
Very good.
understand the what the patient expectation is,
Okay. Great. So
to reduce the anxiety of the patient.
let me also tell you, some of your thoughts are resonating with what I have in mind. So a well-informed patient basically is a partner in their own care, right? You would agree with me. So if you inform them well, they become your partners in their own care. And if that happens, they are loyal to you and they will continue care with you. And there comes the issue of compliance, which you raised. So it's very important that we make them partners by good communication. And that's very important. And I'm sure all of you who are in this profession, whichever specialty or the field you have chosen, I'm sure that ultimately you would like to do good and you would want your patients to improve and do better and do the best what you can for them, right? And that's something which you need to. The added bonus would be you get more personal and professional satisfaction, more work satisfaction. You have renewed motivation because it prompts you to do better and the productivity becomes better. And if there is a positive experience, both for you and the patient, and more so for the patient is inclined to accept whatever you recommend as a treatment, as precautions, and they will return for ongoing care. Not just that, they will bring in more people. They'll refer to their own relatives, their friends to you, and that again is good for you. So increased patient satisfaction is something which definitely, which some of you have said, which will happen. There would be reduced complaints, and then the efficiency is improved for both you and the patients. And what is this patient satisfaction? I mentioned patient satisfaction in the previous one. So what exactly is this patient satisfaction? Can somebody tell me? What is this patient satisfaction? Let's hear from you instead of, can somebody unmute and talk,
Yeah,
please?
PGs, you can use the mic also.
So Imran, you can call out randomly somebody because I may not be familiar with the names other than those
Yes,
you know.
sir.
Yes.
Yeah, Sudhar is there, Sudhar? Shweta?
Yes, sir.
Okay,
Okay.
Shweta. So what
Sir. Hello.
what exactly is patient satisfaction?
So to give the patient the confidence that they'll be able to deal with their problems,
Okay.
so that we assure them that we are capable of treating them.
So when is the so can somebody tell me when is the patient going to be satisfied? When is the patient going to be satisfied?
Hello.
Yeah.
Hello, sir. When the
Yes.
treatment doesn't reach the patient expectation,
Okay.
then there will
So
be insatisfaction from the patient side.
when the treatment doesn't meet or does meet?
It doesn't reach the patient's expectation, then he might get disappointed with the treatment.
Hello.
Yes.
So both psychologically we should assure the patient, and also we should tackle the complaint of the patient.
So excellent. So I think the previous person, may I request you to mute now? Please mute. There is a lot of noise. Yeah. So excellent. So you rightly said patient satisfaction is nothing but perception minus expectations in mathematical terms. So what do I mean? So if I have certain expectation and I come with that expectation to my doctor, my dentist, my clinic, and the perception that I get doesn't meet my expectation, there will be dissatisfaction. If it meets my expectation, I'll be satisfied. If it goes beyond my expectation, I'll be highly satisfied. I'll be totally gratified. I'll be overjoyed. Right? So please remember another thing. People do not care how much you know until they know how much you care. So what is the message I'm trying to bring in? So you may be very good at your skills, you may be knowing your job very well, you may be very knowledgeable, but until that reflects in what you're doing, until that is being seen by the patient that way, and the way that you're showing that care and affection and whatever you're doing to make them your partners, they will not bother. So it's very important for us to demonstrate that, right? So what is good patient care? Good patient care is in the most basic term, what it means is understanding and responding to your patient's need, whatever it may be. So you please understand that and respond to it. And this has a lot of importance of soft skills, including communication. So communication is one aspect. Even your mannerisms, your behavior, your all those things will come into play. Your dressing, your whole setup, the environment that you create, everything, including a very large chunk will be communication. So I hope I have tried to give you the importance of communication. Now let's have a poll. What I would like you to do is please go to menti.com. You don't need to download, you don't need to do any other things. Okay. You just need to uh, just go to menti.com on your mobiles. And once you do that, please enter this code 2774351. I repeat, 2774351. I hope you've done that. So please take another few seconds to do that, and let me in the meanwhile go back to that and show you something. So for a moment, Imran, I'm just going to the other aspect of it. Okay, I will be showing the other.
Yes.
Okay, so I hope the people have already. All right, so I still have people joining in. There are 29 already on board. I'll wait for another maybe 10 seconds. Somebody's gone out. Okay. So I hope you can see the screen. All right. So let's start. So you have a question on your screens. Please answer that. Communication is the foundation of trust. True or false? And let's see how you're doing. So let's see the results. Okay. So all 35 of you think that it's true. Okay. Good. Let's see the next one. Trust is important in dentist-patient relationship. So time is running out. Let's see what you've responded. So one person feels it's false. It's not important. However, the majority feel that it is important. Good. All right. Next one. So the art of communication cannot be learned. What do you think? Is it true? Is it false? Or are you not sure? All right. So you think that it's false, but there are some who think that it's true, that it cannot be learned, and 4 are not sure, fence sitters. But majority of you think it's false. Okay, good. Let's see. And as we go forward with the session, we will see that. So these are the people who answered fast, and that's the end of the quiz. Okay, your poll. So let me now again take you back to where I was. All right. So just give me a moment. All right. So I'm back to what I was on. Right. So you've already seen the results. So basically, like we talked about, some of these things. So is communication a natural instinct? Not really. Do you think that it cannot be learned? Some of you felt that, it's true that it cannot be learned, or you were not sure. Well, let me tell you, it's a skill. Like your dentistry, like, carving a tooth, like preparing a cavity, like delivering maybe a say crown. It's a skill. And if it's a skill, you can learn it. So definitely it's possible. It is the foundation of trust, and it has serious outcomes. The last one I didn't put up. Yes. So with that being said, you require communication in various settings, whether it's this or various settings like maybe seminar, presentations, conferences, teaching, pedagogy session was there earlier. So all those things. So communication is the key. And it is important because it will lead you to have patient satisfaction, compliance, overall health, professional satisfaction, so all these things. And please remember, many of the lawsuits happen because of miscommunication. And many people actually are nervous and anxious when they have to face an audience. Audience could be any size, 2, 3, 5, 10 to maybe 200 to 2000. So communication is a two-way process which helps us to reach a mutuality of understanding where we exchange information and create and share a meaning. So basically anything, exchange of thoughts, ideas, feelings, information, opinions, knowledge, any of these things can be shared and we reach a mutuality of understanding. So it's a process. If you look at communication cycle, the messenger is, say right now it's me who's sending you a message through different channels. So here right now today we are using Google Meet. It could be any of these things, and right now I'm speaking to you and the message is going to you, and you will, the recipient, being the recipient, you will actually decipher my message. That means you're trying to make sense of what I'm trying to say. And then once you do that, how do I understand, or how do I know, or how do I get a feedback? When you talk, when you type in a message in the chat, when you tell me, unmute and tell me, or at the end when I ask you, or when I made you do that poll, I get a feedback that yes, you're making sense, or you're understanding, or you're not with me, or you're with me. Right? So that's a whole cycle. Right? Why is it important? Why should we know that? Because in your patient dentist communication, you do all these things in different ways. You have verbal communication, you have auditory communication, you have visual communication, and you have a written communication. When you write instructions, you write patients' files, records. Right? Now, let me start with the main important thing. Many people think that they do a good job of listening. Is that true? Do you think so? Well, yes, many people think so, but it's actually people are just hearing and not listening. So what do I mean? Now, difference is that in listening, we are actually processing what we hear. Okay, so why is it important to listen? Because people prefer talking compared to listening. And if at all, if we can ask the right questions, we can get the details. And especially in our field where you are going to talk to patients, you need to know their problems. You need to give them some kind of time and listen to them so that you can know what exactly is wrong with them. And many a times we feel that they may not be able to tell. If we can just wait and let them explain to us, probably we'll know. So that's very important. And when we do that, there are certain things which we need to do. We need to be patient, we need to listen, we need to have a eye contact, and we need to paraphrase and say that, okay, as I understand what you're trying to tell me is this is what is your problem. This has been going on for this long, and this is what the inconvenience is. Listening obviously compliments someone. It shows that I'm caring, and it builds trust, which is a foundation for a good relationship, which you already said that in the poll. So basically it requires concentration, a mental connection, willingness to try and see things from another's perspective, and also to suspend judgment. Now, I'm not sure if I can go with the video clip and the audio. Imran, could you please tell me if this works on Google Meet platform? I wasn't very sure, so it's a 1 minute odd video. If not, I
I
can
think
skip it. Right? I couldn't hear you.
so. You can play.
But what about the audio of this, Imran? Will that be played or?
Yes, sir. I think it will be played because I played a video also during the presentation for my UG students. They
Okay.
could hear.
So is there a setting or something which I need to
No,
do?
no, sir. Don't just play, sir.
Just play it?
Yes, sir.
Okay. Did you play it from already the slide, or did you play it
No,
from
no, sir, no, sir. I played it from the player,
Chrome Chrome tab?
and not the Chrome tab, sir. From VLC players.
Okay.
I usually
So,
keep the video downloaded and kept. So I have
okay.
never tried from the slides.
Okay, it's embedded in this. Let me see if it works
It is
fine.
working.
If not, let me know
Please
and I can skip this. That's okay.
confirm you. No, sir, we are not able to hear the audio.
So you're not able to hear, right? Okay. So basically, okay, I will just skip this. So basically, what I'm trying to tell you is that we need to actively listen. And active listening means we need to do a few things. I will just forward this. And so, what are these steps? First is you have to concentrate and not be judgmental. You need to also check for your understanding by probably sometimes even paraphrasing and saying that this is what are you trying to say? Is that true? And then once you do that, check with the other person and if there is anything else that they would want to tell you. And then based on that, you say, okay, let's, try to solve this for you. So you can try this on a smaller scale with, your close people, maybe your friend, and then try this with patients later. So the different ways I've already talked about, the ways of communication: listening, speaking, reading, writing. Okay. So there are multiple ways. Oral can be in different ways, written can be in different ways, and non-verbal can be different ways. So oral will be your presentation, audience awareness, critical listening, body language, all that comes in. Academic writing, revising, editing when you presenting your data, and presenting in seminars, and then making a paper out of it. So all those things will be written. And non-verbal are other things which goes with that. Now coming to verbal communication, we usually speak by mouth. Okay. And now I have also included telephonic communication, even a public address system. Many a times we might be invited on radios and other media like televisions, and many a times we go for lectures, meetings, and conferences, seminars. So these are all verbal communication. Now, communication, in especially in the context of clinics, now we need to put in what we want to from one person to another and also take it from the other person. Now, sometimes what happens is probably we don't gel with the psychological aspects and probably have forgotten that aspect. And that's very important. So please remember there are so many things, including greeting person by name, not interrupting them. And as Dr. Padmini was saying, oh, this is what you want to ask, right? So instead of that, just take a moment or two and let's listen and then ask the leading question. And please remember that smile, that's very important as well. So these are some things which you need to do. Okay. Now, if you see on the screen, I put up a statement which is one of my favorites. And if I could request somebody to read, unmute and quickly read. We need to move on with the time as well. So if I could request somebody to read this.
Postgraduates.
I didn't say.
Hello.
Yes. Go on.
I didn't say you were stupid.
Okay. Can you read the next one, please?
I didn't say you were stupid.
So what is the difference between the two? Is there a difference? Is there a difference? And if so, what is the difference? Yes? I don't think it's so difficult a question for postgraduates. So is there a difference? And if so, what is the difference?
So the emphasis is on say.
Okay.
So it could be implied.
Okay. Exactly. Absolutely. So what is now the next one? Since you said this, so what is the next one now? Can you please read and tell me what is the difference between the three now?
I didn't say you were stupid,
Okay.
which means it could be generalized.
Okay.
Implication over here is you. I mean, so it could be referring to people around you.
Okay. Okay. So as you rightly said, the emphasis is shifting. And the last one, as I put up, I didn't say you were stupid. So the
Yes.
emphasis has shifted to stupid. And as you rightly said, the second one, I didn't say. It is implied. I might have meant it. I didn't say it, but it's understood. I didn't say you were stupid. Anybody else, you have XYZ or whoever was stupid, but not you, mind you. And I didn't say you were stupid. You could be anybody else. You can be dumb, you can be fool, but not stupid, mind you. Right? So that's the difference in emphasis. So how we say it and so many other things that we do. So all that comes under para language, which it's good to be aware, and we should also understand about these emphasis and things like that. Okay. So when we talk about oral, we need to remember these things as well. Coming to written, now we will require written in many of the things, in your case, orders, instructions, even letters, references, memos. And some of the times you might go into positions where you might be contributing to policy manuals, information bulletins right now, COVID and all, information bulletins. But I've also included the last one, if you see, SMS, WhatsApp, and email. And that's very important part of communication nowadays. So we need to be a little formal. Again, if I can request somebody to tell me, you must have read this or seen this, or forward also maybe on WhatsApp or whatever. So if this sentence is written like this, and if it's written like this, the meaning changes, right? So a woman without her man is nothing. A woman without her man is nothing. And the third one, a woman without her man is nothing. So you see that the punctuation mark is very important, which is powerful, and it changes the meaning. So again, when I'm writing, I need to understand that and put that in that proper perspective. Again, a few things you might require when it's you write a letter, you write an application to the university, to the head of department, head of institution, you write reference for opinion or consultation. That was one of the things I had put up. Or you want to email, WhatsApp, or SMS, there are certain things you need to do. So when you put up things, don't put up, generalize, or in this case, there was a consent. And it also says that, in spite of knowing all the things and all the kind of the adverse things which are going to be, I am hereby consenting, neither the doctor nor any other person or hospital shall be held responsible for any untoward outcome, including death. Now that's, you need to put it in a proper way. And this is again one of the actual consents, which is again from pre most of printing. Now we have gone for printing. Again, if you see here, this is a very badly written, a letter of request for actually trying to ask somebody for delivering some kind of a lecture. Okay. Similarly, this is okay, but this can be better. So when you are requesting, you can always start off with, thanking the person or thanking for maybe deputing or permitting you, and that becomes automatically much better. And then you can say that what happened, or maybe so that kind of thing can be. Now again, this is an actual CV. Somebody applied. Okay. Now where is the CV? Similarly, when you write a personal statement, you need to remember that you need not make any mistakes. You shouldn't ideally make a mistake. These kind of things actually go against. So all these things, and including that SMS language, I am sure. So all these don't go well. And that's why many of the universities abroad, they want you to write a personal statement, write a paragraph, write, why you want to apply. So all these are important. Now look at this. Somebody is writing, and then I think it will bring out the best of myself in pulling off this post. And then see, it's so much of I can do that. I as vice president, I can handle this. Okay. So those things again sometimes may not be very well taken. Similarly, if you look at this was somebody who wrote an application to be excused, and you look at the spelling for this act of kidness. Of course, it was well meant as kindness, but look at this. This is very important. And this is again very recent. So all these are important. Okay. So I have highlighted a few things just to tell you that this is very important. Again, if you look at this, it's not a permission being taken. Rather, if it's being informed that I am going and I won't be able to attend, and then later it is request to shift the viva. Okay. Now you look at this again. very brief, not really, and then more apologetic. So it need not be written like that. Nowadays we understand and accept that yes, you can mail, you can, ask for, because you are not physically around here, and thanks to COVID again, it's acceptable that you can actually do things online as well. So you need to greet, you need to write a formal mail, you write something about yourself, whenever you were student, what you want exactly, any particular emphasis when you want a particular, say, recommendation letter. So all that has to be included. And this is another example which I want to. So having got that, please don't just forget about it. It's always a good thing also to get back and tell your, whoever mentor, superior, or dean, or and say that, I got selected, or this is what happened. And so this is reproduced with permission again. That's another good practice. So that's why I have not masked the name. So this is again, if you look at, it feels so good when somebody writes back saying that, I got selected, and you had the role to play in my selection because you gave a referee, you were one of the referee, and you gave me a reference letter. Again, if you see many of the universities abroad, they ask people to be judged on certain things, written and oral communication. So again, what I'm trying to bring in is it's important. So when somebody applies, your professor, your head of department, head of institution will get this, and they will have to fill and judge you. And ideally, if I have to judge somebody, I would not just judge it because it was my student, my institution student, but actual what the person was good at or was doing well. And again, if I may not remember, I would like to go back to documents. So that's why that importance of telling me when you were a student, what you had done, so that I can look at the records. And most of the good institutions preserve those records. They will be able to retrieve those, right? So with that, I go into non-verbal communication. Now that includes body language, with some part of it Padmini has tried to tell you about in the previous session in seminars. So of course, facial expressions. It's easier when you have the audience in physical presence. Little difficult in say webinar or online sessions. Eye contact, again, similarly, previous two speakers have talked about the postures, the gestures. Sometimes when you are also even touching, with of course a warning that please remember cultural sensitivity, gender sensitivity, because that should not lead you to problem. And then you'll say, Animesh sir told me. No, please remember that these things have to go with cultural and gender sensitivity and where appropriate. Non-verbal communication has its own meanings. So if you see a person is smiling, you feel very welcomed. There's a face which just is flat, or you see a frowning person. Obviously, I wouldn't like to go to a frowning person. Below you see the open gesture and a closed body posture. So open person is much more friendly, accommodating. So I would like to, whereas the other person looks like very reserved, probably would not entertain me. So until and unless I really want to, I may not want to go and interact with that person. Similarly, these things, gestures, sign languages, they have their own importance. So when you point it to patients, when you point it to a child, or say even in class, it has its own connotation. So instead of sometimes pointing a finger, you can do an open gesture if I'm visible. So you can just go like that. You can have a fleeting glance. You can use those things which are non-threatening. Please remember, non-verbal actually gives you 65% of your communication, and 35%, and some people say even lesser, is verbal. Okay. So how do you again use it to your advantage? You please make sure that your facial expressions should be always in such way that people feel welcome. So use them to your advantage and demonstrate that you're listening. So when you're looking at a person, when you're talking to a person, or you're listening to a person, they're talking to you, give them that kind of expression where they feel, yes, this person is actually listening to me. And silence is also important. Sometimes somebody is telling you a painful story, just be silent and say, okay, yes, and then come back and then comment, and okay, it's very painful experience you had. I can, not imagine what you had to go through. So automatically that person will connect, will open up. So it's very important for you to build your message by assessing the whole situation. Go to the whole situation, decide whether it's your patient, your treatment requiring, and then build your message. And then once you've done that, you need to deliver it and also document it. Because in this era, documentation is very, very important. So your whole message has to have clarity, adequacy, and at an appropriate timing. Because you can't postpone it to some other time, and then it can lead to detrimental effects. And whenever, whatever you do it with integrity. That means I'm doing it with all my best wishes and meaning well for you. That means I'm doing the best even when nobody is watching me. And that's something, the conviction I should have. So that's something which makes a good communication. So a good clinician treats the disease, but the great clinician treats the patient, said William Osler, Sir William Osler. And if I had more time, I would have written a shorter letter, said Winston Churchill. What does that mean? Basically, that means that if you need to make it short, that means you need to have a longer preparation. And somebody was talking right earlier, and then Dr. Imran asked that, if you have a long topic, so you can crystallize and condense it, but you need much longer time to prepare it. And it's not easy to do that. And of course, it comes with practice. So you need to understand that as well. Now, before I end, I want to give you 7 C's of effective communication. 1, your communication should be complete. It should be concise. So even if you are complete, but keep it concise. I can't go on talking and talking and talking, and ultimately the patient may be confused, or my audience may be confused. So it should be complete, but at the same time, it should be concise. Your message is clear. It should be considerate. Considerate towards your patient, considerate to the audience, and it should have clarity. It should be very concrete. That means whatever I have spoken, there is something very concrete, solid, and there is meaning and purpose. And it should be correct, factually correct. I cannot go and give you wrong information. It should be very courteous. It should come across like that. For example, I'll tell you, when we come in with a patient, now to give you an example, last week I had to be a dentist. Of course, very, few things are being treated and emergency only. So I had an emergency, and I felt so welcomed when my dentist, actually took care of me, talked to me. And another few things which I would like to, give you an advice about is, when you talk, people can feel and perceive. So when you talk to them in something which is simple and understandable. Also talk to them at their eye level. So when you're making them sit at the dental chair, before you take the history, don't put them down and then it's not a good thing, which you will also learn from the literature. So talk to them at eye level, or maybe talk to them and then take them for examination, and then do that. And then while you're doing it, also keep them engaged, keep them informed. So my dentist was doing that. And then you involve them and also tell them that you are available. Once that whole thing is done, you give them instructions. Give them something before they can even ask you. Anticipated things you can come forth and tell them. And then tell them they can get back, or maybe check on them later. So that makes it feel much better. And that's a very good practice, a successful practice. So communication is one thing, but the whole atmosphere, the environment you create is also very important. So take home messages: for good patient care and outcome, clinical skills and soft skills are equally important. It's not just one, takes a precedence over the other. Both go hand in hand. Every good conversation starts with good listening. So you need to start listening. Good communication entails more than just spoken or written words, as I've already told you and demonstrated that. So with that, I would end. And I would also thank Dr. Imran and the Yenepoya Dental College and Yenepoya Dental College Education Unit, Dental Education Unit, for giving me this opportunity. I would be happy to take some questions if you have, or clarify. I've tried to give you a very, brief overview and a bird's eye view of the communication, and tried to sensitize you. This would be a very good workshop maybe, but of course, with the challenges of the technology and the limitations of the time and also the physical presence, I could think of this is the best what I could. I would be happy to take questions. So, thank you.
Thank you so much, sir. This is a very informative session, and I'm sure the postgraduates and many of the faculties They'll have different angulation of looking into the communication aspects. We'll take some questions now. The discussion is open now. Postgraduates, you can come up with some of the questions. You can type the questions also in chat section. So let me start with one question, sir, regarding
Sure.
should this topic, do we need to include in our postgraduate teaching curriculum, that communication skills as a separate topic, as a general topic?
So that's a very good question, Imran. And I think you're aware that many people are trying to make an effort, but I'm again going to ask you one question before I answer that. So, is there a possibility and a provision to include that? And if so, where? Like, do you have the liberty and the flexibility to do that in your curriculum? That's something which you need to answer before, you can go ahead with, or I can answer that. So if you think, personally speaking, I would suggest that yes, there should be. But again, I don't want it to be didactic. I don't want it to be like theoretical. I don't want it to be just for the sake of being there. And what I mean is, I keep some sessions, I keep some, lectures, I keep just time, and then it will just become a routine. So instead of that, this can be done in different ways. This can be done in the process where you have seminar presentations, and in that itself, maybe you can build in the component where you can talk about these things. So when they present, you can give them feedback. You can, or maybe you can keep certain, like, sometimes just a say very small segment of the presentation could also be addressing on these aspects. So that can be done, or it could also be an ongoing thing, an engaging thing, or maybe once in a month, or say something like that. You can decide where you will discuss on these things. So it could be very kind of informal ways also. It could be a mix of that, and it could be that some people read something and then pass it on. So it could be in different ways, but not just making it just mandatory and then putting it in the curriculum and then just doing it just for the sake of doing, because that's what happens many a times. And especially when it becomes compulsory, then it's just like for both faculty and the students, it becomes a burden, which I don't think is a good idea. I'm not sure if I've answered what you wanted to.
So this is Dr. Imran here.
Yes,
Can
please
you
tell
hear me?
me. Yes.
So communication as a soft skill, what do you feel, sir? Sir, you have told in the communication, but how do we go about introducing this topic in a much better way to the students? Now this time we have included in our postgraduate curriculum. Would you suggest that this is the way to go about it? Every year we have first year postgraduate students joining in. Should we be keeping as a part of this lecture, or should it be included in some sort of a module? I hope in the MCI, in the EdCom module, I think communication skills is one of this one. So should we develop that kind of a thing? So just to have a broad idea.
So again, very good question, Imran. I'd suggest that yes, and this is, see, what today it's happening, and we also do it in our own postgraduate orientation and sessions. So this is basically only a sensitization, right? So this is good to do a sensitization, and you made a very good beginning. So I compliment you and your team, and Dr. Akhtar and team, for doing this, and very good thing you started off with. But having said this, just one session will not make a difference and will not change everything. So what you need to do is, further you need to probably think of, and periodically you can even have some kind of at least, since you don't have a module like that, even EdCom has taken a lot of years, and though it was already there few years back, only now it's getting implemented. Okay, the document was already there, and there was like a move to do that, but a lot of resistance, and even now. So what I would suggest is, you can take it in a different way, and you can start with that, and then you can start developing a module. So that could be one of the things you can probably initiate. The other thing I would suggest is, maybe think of inbuilt kind of training. So what I mean is, other than those sessions, or and especially for postgraduates, it's possible, because what you can do is, when they are presenting seminars, when they are presenting journal clubs, when they are going and presenting in, say, conferences. So before that, and also during the other times also, you can have some feedback given, even their patient care, even those. So they can have these kind of things which are discussed. One thing is, like, for these things you need to first have an awareness. So once I'm aware that there are some things which can be done and which I can learn and which I can do better, automatically I will move towards that. So first thing is awareness. Second is then you try to give them that kind of environment. So and very importantly here also, they also will learn by seeing others. So the whole thing also has to come in as well. So it is like mix of lot of things. So I think it's a good idea to go for a module, but that will be a little say intermediate or a long term thing. But to again make it short and answer it to the point, good beginning made. Keep up this and maybe have some 1 or 2 workshops and take more feedback, and then so what you need to do is continue this and build on that.
Thank you, sir. Thank you for the wonderful insight what you have given for today. And I hope all the participants have learned that communication is very important. And you have been such a wonderful speaker, sir. Thank you. Thank you for the lecture.
Thank you so much for the opportunity, Imran.
Thank you, sir.